There's a conversation every man over 60 should have, but it almost never happens. Not in a doctor's office or casual chats with friends. It's a serious, direct, but completely necessary discussion about 5 simple, natural habits that can significantly improve prostate health. This is science, true science, based on rigorous research that has helped thousands of men age with more freedom, less pain, and significantly better quality of life. If you're over 60, or if you have a father, grandfather, husband, or friend in that age group, stay with me until the end. One of the 5 habits I'll share might completely surprise you. But before we dive into them, you need to understand why prostate health deserves so much attention after 60. The prostate is a small gland about the size of a walnut, located just below the bladder. Its main job is to produce semen. However, as men age, especially after 50, the prostate tends to enlarge. This condition, known as benign prostatic hyperplasia, BPH, is very common. According to the National Institutes of Health, NIH, the likelihood of developing BPH increases significantly with age. Ages 51-60. Over 50% of men have microscopic evidence of BPH. Ages 70-79. Around 80% of men are affected. Over 80 years old, the prevalence rises to approximately 90%. In Europe, large-scale epidemiological studies, such as the EPILOT study, Epidemiology of Lower Urinary Tract Symptoms, which surveyed over 19,000 men and women across the UK, Germany, and Sweden, confirm high rates of BPH. United Kingdom, the NHS reports that about 1 in 3 men over 50 will have some urinary symptoms related to prostate enlargement. The clinical rates of BPH requiring treatment rise sharply after 60. Germany. With one of the oldest populations in Europe, Germany has a very high rate of BPH. Studies estimate that over 60% of men over 60 have BPH symptoms. European studies continually emphasize the profound negative impact of lower urinary tract symptoms, LUTs, related to BPH on quality of life, especially due to sleep disturbances, frequent nighttime urination, anxiety, and restrictions on daily activities. Enlargement of the prostate can press against the urethra, leading to difficult urination symptoms, weak urine stream, trouble starting urination, feeling of incomplete emptying, and frequent trips to the bathroom at night. While many men think these symptoms are just a normal part of aging, science shows that simple daily habits can prevent excessive growth and even reverse symptoms. Here are 5 habits that have the most powerful effects, along with deeper scientific insights to back them up. First habit, drink enough water to reduce prostate inflammation. It's simple but effective. Drinking enough water can significantly reduce common urinary symptoms in men over 60, and the key is not just how much you drink, but when and what you drink. As we age, our sense of thirst gradually diminishes, leading to mild chronic dehydration. This results in concentrated, acidic urine filled with metabolic waste. This concentrated liquid acts as a direct irritant to the lining of the bladder and prostate tissue, causing inflammation and worsening symptoms like frequent urges to urinate. The mechanism behind this is that when urine becomes concentrated, its higher osmolality and lower pH can trigger an inflammatory response in the bladder wall, causing it to overreact. This is the main cause of the sudden and strong urge to urinate. A simple adjustment can make a big difference. Strategic hydration. The recommendation is straightforward. Drink plenty of water in the morning and afternoon by sipping slowly, and reduce water intake 2 to 3 hours before bedtime. This approach allows the body to flush out toxins effectively during the day, while preventing the bladder from becoming overly full and disturbing sleep at night. In a study published in the Journal of Urology with over 2,000 men aged 60 and older, this hydration strategy was shown to reduce symptoms of incomplete urination and frequent nighttime urination by 41%. This small change costs nothing but can significantly improve sleep, protect the prostate, and provide real rest for the following day. It is the first step and one of the most effective habits to incorporate into your daily routine. A useful tip: consider adding a pinch of salt to your water using sea salt or Himalayan pink salt rather than refined table salt. These salts provide additional minerals to your body. However, if you have any existing health conditions, it's best to consult your doctor before trying this tip. Additionally, the American Urological Association, AUA, advises men with BPH to limit bladder irritants like caffeine and alcohol. Both are diuretics, meaning they increase urine production and can worsen frequent urination and urgency. Alcohol, in particular, can relax the bladder neck muscles, sometimes making urination more difficult. Second habit: take a gentle walk after meals to improve blood flow to the prostate. A short 15-minute walk after a main meal has a profound and direct impact on prostate health, yet it is often overlooked. This simple action not only aids digestion, but has powerful additional benefits. A study published in the Journal of Urology found that men who engaged in regular, moderate physical activity had a significantly lower risk of developing BPH symptoms. The key is consistency. A short, gentle walk every day is more beneficial than intense exercise done irregularly. Walking stimulates blood circulation throughout the body, including the important pelvic region. The increased blood flow brings more oxygen and nutrients to the prostate, helping reduce localized inflammation and supporting healthy cell function. Additionally, walking after a meal is excellent for blood sugar control. High blood sugar and insulin resistance are significant risk factors for benign prostatic hyperplasia, BPH. Increased insulin levels can stimulate the production of insulin-like growth factor 1, IGF-1, a hormone that promotes cell growth and may contribute to prostate enlargement. By regulating blood sugar levels, you directly influence the hormonal environment around the prostate. Walking right after eating stimulates blood circulation in the pelvic area, helping deliver more blood, oxygen, and nutrients to the prostate. This aids in reducing inflammation, improving cell oxygenation, and gradually normalizing prostate function. Furthermore, walking helps control blood sugar, which is vital as diabetes is a well-known risk factor for prostate enlargement and more severe urinary symptoms. Another important factor is its effect on overall inflammation. A sedentary lifestyle, especially after meals, increases inflammation in the body. Gentle movement helps reduce these inflammatory markers and protects tissues, including the prostate. In a study conducted by the School of Medicine at the University of São Paulo with men over 65, those who walked for just 15 minutes after lunch and dinner had a 35% lower risk of experiencing moderate to severe symptoms of benign prostatic hyperplasia. You don't need to walk long distances or use a treadmill. A gentle, consistent walk every day, whether around the house, down the sidewalk, or even in a hallway, is sufficient. This habit may seem small, but over the years, it significantly protects the prostate due to its regularity. Third habit: regular sexual activity to protect the prostate and naturally cleanse it. This is one of the most effective habits for prostate health, but due to outdated taboos and misconceptions, it's often overlooked by older men. This habit involves maintaining regular sexual activity. Modern science has clearly proven that frequent ejaculation promotes a form of internal cleansing for the prostate. It helps eliminate accumulated secretions, dead cells, and toxins that can build up in the gland. And this is not just a theory. A study conducted by Harvard School of Public Health, published in the European Urology Journal, tracked over 10,000 men for 2 decades. The research found that men who ejaculated at least 21 times a month had a 33% lower risk of developing prostate cancer over their lifetime. In addition to its cleansing effects, sexual activity also improves pelvic blood flow, relaxes the muscles around the prostate, reduces stress levels, and improves mood, all of which help reduce localized inflammation, a major factor contributing to prostate problems. Unfortunately, many men over 60 still approach this topic with feelings of guilt or embarrassment. However, from a medical standpoint, maintaining an active sex life is a natural, safe, and effective way to care for prostate health. If you experience difficulties with sexual function, it's important to speak with a urologist. Often, issues like erectile dysfunction can be early warning signs of other health conditions, such as cardiovascular disease or diabetes. Addressing this problem is not only about sexual health, but also about your overall well-being. Fourth habit: eat strategically to reduce prostate inflammation and cancer risk. This habit is closely linked to something you already do every day: eating, but perhaps not with the right intentions. When it comes to diet, certain foods directly protect the prostate, help reduce inflammation, lower the risk of benign prostatic hyperplasia, BPH, and even prevent cancer. The onset of cancer cells can be influenced by what we eat. One of the most studied compounds related to this is lycopene, a natural antioxidant found in foods like tomatoes, watermelon, and guava. This red pigment has strong anti-inflammatory properties and directly impacts prostate tissue. Here's the key: lycopene, tomatoes, watermelon. This powerful antioxidant neutralizes free radicals, unstable molecules that can damage DNA and lead to cancerous changes. Lycopene appears to concentrate in the prostate tissue, where it can also interfere with cell signaling pathways that promote tumor growth. A study published in the International Journal of Cancer found that men who ate cooked tomatoes at least twice a week had a 28% lower risk of prostate cancer. Another essential nutrient is zinc, found in pumpkin seeds, nuts such as almonds, cashews, walnuts, pumpkin seeds, sesame seeds, sunflower seeds, and hemp seeds, and seafood like oysters, crab, shrimp, lobster, clams, and mussels. Zinc is the spark of masculinity. It's essential for immune function, wound healing, and most importantly, hormone health in men over 60. Zinc helps balance hormone levels and maintain prostate tissue health for years. Additionally, vegetables like broccoli, cauliflower, and cabbage contain compounds known as sulforaphane, which support the body's detoxification processes and help prevent cellular changes in the prostate. Ideally, meals should be fresh and plant-based, including cooked tomatoes, leafy greens, mineral-rich seeds, and a good source of lean protein. When consumed regularly, these foods work subtly but powerfully to keep the prostate less inflamed, better oxygenated, and metabolically balanced. Johns Hopkins School of Medicine recommends a diet rich in omega-3 fatty acids found in fatty fish like salmon and sardines due to their anti-inflammatory properties, and green tea catechins such as EGCG, which have been shown in laboratory studies to inhibit cancer cell growth. On the other hand, large organizations like the Prostate Cancer Foundation advise limiting the consumption of red meat and high-fat dairy, as some large-scale studies have linked them to an increased risk of invasive prostate cancer. Instead, it is better to choose a Mediterranean diet, which includes olive oil and plenty of leafy vegetables. When managed properly, nutrition becomes a form of preventive medicine and can be one of your most powerful allies in protecting prostate health. The fifth habit is getting deep sleep to regulate hormones and protect prostate health. This habit is often overlooked by many men, yet its impact is far greater than most people realize. Quality sleep, deep and restorative, is crucial for maintaining hormonal balance, which directly affects prostate health. During deep sleep, Especially during the most restorative phase of the night, the body produces regulatory hormones such as melatonin and growth hormone. Both of these have anti-inflammatory effects and help protect prostate tissue. When sleep is disrupted, shallow, or insufficient, these hormonal cycles are weakened, stress levels increase, free testosterone levels tend to drop, and inflammation in the body rises. A study published in Cancer Epidemiology, Biomarkers and Prevention tracked over 2,400 men for nearly a decade and found that men with sleep disorders were twice as likely to develop aggressive forms of prostate cancer. The explanation is simple. Without quality sleep, the body cannot effectively repair tissues, making the prostate more vulnerable to inflammation and degeneration. This is why creating a peaceful, dark, quiet, and consistent sleep environment is crucial. It's not a luxury, but a preventative strategy. Deep sleep not only helps refresh the mind, it also protects the prostate every night, even if you don't realize it. To improve sleep quality, the National Sleep Foundation recommends establishing a consistent routine. Go to bed and wake up at the same time every day. Make sure the bedroom is completely dark, cool, and quiet, and avoid blue light from screens at least 1 hour before bedtime. Deep sleep not only rejuvenates the mind, but also actively protects your prostate every night. Finally, decades of research have transformed benign prostatic hyperplasia, BPH, from a condition mostly treated with invasive surgery to one that can often be managed with medication and lifestyle changes. Here are some of the most influential studies. First, the MTOP study, Medical Therapy of Prostatic Symptoms, published in the New England Journal of Medicine in 2003, aimed to determine whether long-term treatment with alpha blockers, doxazosin, 5-alpha reductase inhibitors, finasteride, or a combination of both could slow the clinical progression of BPH better than a placebo. Key findings. Combination therapy was the most effective. The combination of doxazosin and finasteride reduced the risk of overall clinical progression, such as worsening symptoms, acute urinary retention, or the need for surgery, by 66% compared to a placebo. Finasteride alone reduced the risk of progression by 34%. Doxazosin alone reduced the risk by 39%. Significance of the study. MTOPS was a groundbreaking long-term study that fundamentally changed the treatment approach for BPH. It found that for men with large prostates and significant symptoms, combination therapy was more effective than monotherapy in preventing long-term complications. This study is now the foundation of global BPH management guidelines. Additionally, the PLESS study, PROSCAR Long-Term Efficacy and Safety Study, published in the New England Journal of Medicine in 1998, evaluated the long-term effectiveness of finasteride in reducing BPH symptoms and the risk of surgery or acute urinary retention. Key findings. Over 4 years, finasteride reduced the risk of surgery related to BPH by 55%. It reduced the risk of developing acute urinary retention by 57%. Treatment resulted in a 20% reduction in prostate volume and improved urine flow. PLESS was the first large study to show that a medication could not only control symptoms, but also alter the natural course of the disease by shrinking the prostate and preventing serious complications. This study solidified the role of 5-alpha reductase inhibitors as a primary treatment for men with significant prostate enlargement. Lastly, the Health Professionals Follow-up Study, HPFS, initiated in 1986 by the Harvard T.H. Chan School of Public Health, is a large ongoing cohort study that examines the relationship between diet, lifestyle, and various diseases in men. Several publications from this study have focused specifically on BPH. Key findings related to BPH. Physical activity, men who were more physically active had a 25% lower risk of developing symptomatic BPH compared to sedentary men. Even light to moderate activity, like walking, was beneficial. Diets high in red meat and fat were associated with an increased risk of BPH, while diets rich in vegetables, fruits, and healthy fats were linked to a reduced risk. Obesity. Men with higher body mass indexes, BMI, and larger waists were significantly more likely to develop BPH and require surgery. Significance. HPFS provides some of the strongest evidence that lifestyle changes are not only complementary, but also key strategies for preventing and managing BPH. It scientifically supports the advice to exercise, maintain a healthy weight, and adopt a plant-based diet to protect prostate health. If you found this information helpful, I would love to hear from you. Please leave a comment below and let me know which topics you'd like us to focus on in the next video. Share your challenges or success stories with us. Let's build a community of strong and happy men. If you enjoyed this content, don't forget to subscribe to the channel and turn on the notification bell. Feel free to let us know where you're from in the comments. I look forward to hearing from you. See you in the next video.